Hey everyone, welcome back to the Veritas podcast. I'm Scott Fowler. This is episode number 4. We're here with Dr. Hatemi.
Hello guys.
And today we're going to talk about
Ozempic and Mounjaro.
The big topic. It's all over the media, Hollywood, celebrities are taking it. Some are saying they're taking it. A lot of people are seeing celebrities lose weight and they're definitely on it.
Absolutely. It's the big medication. There's a huge shortage. Everybody wants it. And everybody asks me questions about it every day. So let's make a podcast about it.
Absolutely. And both Dr. Hatemi and I have taken versions of it. So let's get into it.
Let's do it. It's kind of unique that you use semaglutide, glipizide, and semaglutide, which is Ozempic, the active ingredient in Ozempic. And I use Mounjaro, which is tirzepatide. So we both use different medications. And we have different outcomes. So it will be a good comparison. We talk about this.
Yeah. So I'll let you go ahead and get started.
So it's the big interest from the media and the general population about these two medications because it's a huge improvement in diabetes control. It's something that you don't have to take every day. You take once a week. It's a self-injectable method. It's very easy to use, and it has a very good control of your diabetes. I see people managing their A1C levels in a much efficient way. Also, it has a side effect which is very desirable. It's weight loss. And when people hear about the weight loss, it gets a lot of attention in the media.
Yeah, so I believe it was that these drugs came around about 10 years ago, and originally it was for type 2 diabetics to lower their blood sugars and A1Cs, and then they discovered it had this amazing side effect of satiating you. Yep. And making you feel full longer, so people easily lost weight. So then about a year ago, maybe a year and a half now, the FDA approved these drugs specifically for weight loss. Before it was only for diabetics.
Semaglutide is, but Ozempic not yet. Mounjaro not yet, okay. But Mounjaro soon will be. It's in the process to be approved. So.
Gotcha.
But it can still be used off-label for weight loss. There are certain differences. Semaglutide is the first one in the market. It works great for weight loss. But Mounjaro came, and Mounjaro actually is much more effective.
They say it could be 30% more effective.
Absolutely. It's much more. I mean, you use the semaglutide, and you lost some weight, but I lost 40 pounds on it in 2 months, so I have a much better outcome than you did.
Yes, yeah. I feel mine was a much more milder experience overall. Less weight loss, less side effects.
Yes, and there are big studies comparing these drugs side by side, and they proved Mounjaro is more effective. We don't know quite yet why. There are some theories about why it's more effective. Semaglutide works on GLP-1 receptors. Mounjaro, tirzepatide, works on both GLP-1 and GIP receptors. So it works on 2 different receptors instead of 1.
So I have no idea. What do these peptide receptors do? What are they in our bodies?
It's multifactorial. It affects in many different directions. So it increases the insulin secretion. So your insulin levels goes up. So that helps you. Glucagon levels goes down. That's how it works on diabetes. It works on your brain. It decreases your appetite significantly. And also it slows down the stomach emptying. When stomach slows down, when you eat something, it stays longer in your stomach.
I certainly noticed that.
Oh, yeah. When you eat a big meal like a steak, halfway through you feel full because it's not moving through your stomach. Yeah. So it stays in your stomach longer. So that actually prevents you from getting hungry early on.
Yeah, and something simple like a protein shake makes me feel full versus before I'd still be hungry.
You don't want to eat anything. Appetite is shot for like a couple days after you take it. The problem is there are shortages. So there are different pharmacies, they're running out of it. But now we know some local pharmacies actually carry it. So we have access to it. As long as it lasts. Mm-hmm. Also, there are coupons now. So if you don't have any insurance or you don't have diabetes, and in that case, even if you have insurance, your insurance will not pay for weight loss, which doesn't make sense, You will think that your insurance company will like you to lose weight.
I think they'll come around.
I think so. That will change. It's $500 per month right now. I heard it from a pharmacy friend of mine that you can get it for $500.
And just a few months ago, really just a month ago, this was $1,050. So this is more than a 50%
So that's
reduction
half price now.
in
And
price.
if you have diabetes, even better. So you can get it with your insurance. Certain insurances pay for it. Depends on your insurance. So you can give it even cheaper if you have type 2 diabetes. I have seen quite a bit effects on patients. I have one patient lost 100 pounds. I have
Wow.
another one lost 80.
So how long were these 80 and 100 pound losses? How long have they been on the medication? Would you approximate?
So there are different factors in that one. One of them is like how much you weigh when you start.
Yes,
with-
so I've learned from experience. I used to weigh 300 pounds. Those first 20, 30, depending on how heavy you are, that first block of weight is very easy to lose it. It comes fast.
The heavier you are, the easier to lose.
Correct.
From going from 300 to 280 is much faster than going from 200 to 180 because you are a much bigger guy to start with or much bigger person if you're a woman. So you will lose that 20 pounds initially if you're a bigger person. So it depends. Actually, it's good news for heavier people.
Yes, I agree.
My ballpark is about 20 to 15 pounds per month weight loss we are talking about, which is very drastic.
Yeah, this is something that was almost impossible to do without an incredible life change, like cutting calories in your diet, changing your diet completely, and exercising almost every day.
Yeah, we still recommend you to exercise. And also, I tell all my patients, I put on Mounjaro, that do yourself a favor, still get a protein shake that has all the vitamins, all the essential amino acids and minerals, because you don't want to go to a nutrition deficiency just for the sake of weight loss. So do yourself a favor and get a protein shake, which is pretty good quality, so that way you don't go into a deficiency just the sake that you are losing weight.
Yeah, I'll say the big thing for me is I was eating a clean and healthy diet a few months before I started the semaglutide, and I was also exercising 6 days a week. So as soon as I jumped on the medication, everything changed. I was a lot less hungry. I was able to control my diet. I'm a binge eater, especially at night. That's my problem. It's why I struggle with weight loss, but this was able to help curb that. And then I lost 11 inches in 60 days. And I think that's because it was a combination of the semaglutide and 6 days a week cardio and exercise that not only was I able to lose 25 pounds, but so many inches. And I think without the medicine, that number would have been cut in half.
Absolutely. People talk about side effects, symptoms. I mean, I think you have similar
So
side effects. What did you have, like when you
me,
took like semaglutide?
Yeah, I'm still on it. I'm halfway, like 1 or 2 weeks into month 5, and so I get a very mild acid reflux, and I can feel it, bubbling in my stomach constantly, especially if the day of the injection and 2 or 3 days afterwards. It's pretty mild though, but I do feel that acid reflux building, and it's constantly going in my stomach. But I've only felt nauseous a couple times, and it's when I've eaten big meals with really heavy fried foods, and then I'll vomit afterwards. It's happened a couple times.
Because if you have fatty food, it moves slower
Yes.
because your stomach automatically slows down, and on top of that, you're already slower because of the medication. So you need to avoid fried food. So
Yeah.
don't hit Russia's or Chick-fil-A,
Exactly.
any fried food places at all.
And for me, it was Cava, which is generally you look at as a particularly more healthy restaurant, Mediterranean style. So I had a nice big Cava bowl, but then I had some freshly fried pita chips right after that, and it got me instantly. Just boom. Same thing with eating Mexican food. I had a decent-sized burrito, which would normally be okay, but then especially for me, that freshly right out the fryer chips just set me off. It was instant vomiting, almost.
I have similar symptoms. I think I had more symptoms than you did.
Yes, yours seemed much more stronger because, again, on what I'm on, it's only hitting one of those receptors, and then it's not as powerful
Absolutely.
dosage.
I mean, I had more side effects, but I also lost more weight. I think I got nauseous. I couldn't eat. When the first injection, I couldn't eat for a couple of days. Just water and liquids. I couldn't eat solid food. Every morning I wake up, I will throw up, and I would be fine for the rest of the day. I had some mild to moderate fatigue. My body hurt first week. I feel a little fatigued, but then when you lose weight, you get encouraged.
Yes.
And symptoms get better with each shot. So your second shot will not be as harsh as the first shot.
Yes, the first couple shots for me, I felt a little down in general
Absolutely.
as well, and I didn't feel normal. I felt a little ill, but I couldn't describe it as something that I had ever really felt before. It was different, but I just felt a little sick, and it did affect me for a couple days after each of those beginning injections.
And I did 2 different doses of Mounjaro. I did 10 milligrams and 15. 15 was very harsh. For me, that was very hard to tolerate. But 10, I think, is the magic number for me. And I was starting at 260 pounds. So a 260-pound male, I think 10 milligrams would be the right dose for Mounjaro. I mean, I have more side effects, but I lost more weight. I also get a lot of questions about who should not use Mounjaro. There are some theoretical contraindications, so we avoid those at any cost, just in case. I mean, it's not really proven very well, but it's pharmaceutical company came up with these contraindications, which is not that difficult to overcome. It's if you have a history of thyroid cancer or you have a family history of thyroid cancer, specifically thyroid medullary cancer, you should not take these medications. Also, if you have a history of pancreatitis, you shouldn't take this medication. And there's some rare endocrine syndromes like MAN2 syndrome, multiple endocrine tumors, you should avoid taking. So it's a small group of people who can absolutely not take this medication by now. This might change in the future. But I think there's a huge benefit taking this medication, especially the weight loss.
Yeah, so again, those folks that were 80 pounds and 100 pounds, about how long did it take them to lose that weight? How long were they on the...
My calculation is 15 to 20 pounds per month.
Oh, wow. So that really was happening with these patients.
Oh, yeah. So,
consistently. That's what's so hard to find is I've been on my own weight loss journey for a long time, and to stay consistent like that, that's incredible.
I have one patient, he lost 100 pounds in 4 months, and his A1C went from 12 to 5.5.
Wow,
12 is a crazy number, and 5.5 is normal A1C.
Wow.
For anybody who knows anything about diabetes and knows about these numbers, this is unseen, unheard of. I mean, it has never seen such a good glucose control with anything else in my life.
So that sounds like a pretty enormous benefit that you get from this medicine. Not only the weight loss, you're controlling your A1Cs. What are the other side effects that you've heard of? Is it really, I think it was 1 out of 10 with semaglutide get nausea, 1 out of 20 get vomiting.
I think those numbers actually very, I think it's much more than that.
You think so?
I think nausea and vomiting is much more than those numbers. I think you should expect to get nauseous and vomiting when you get it. But we can overcome that with nausea medication like Zofran. We can give these patients mostly, and that can help negate some of the negative side effects.
Yeah, and does like IV stuff, could that help
No,
as well?
it's pills, like sublingual dissolving Zofran. These are pills, and they're not that expensive, so we can give you those with the same medications and negate some of the side effects. But it is a big improvement. Metformin is another pill we give. It will help with the weight loss. And you don't need to change your metformin dose when you get on Mounjaro, so you can stay on metformin.
So what is metformin? What does it
Metformin is a diabetes medication, so
Okay.
it helps with the body to control diabetes. So if you're on metformin for diabetes, you should stay on the metformin unless you have bad side effects from metformin too. And you know, another question I get, people say, should I be on it for the rest of my life? Well, if you're diabetic, yes. If you're not diabetic and using this only for weight loss, no, you don't need to be on it for the rest of your life. I used it for 2 months and I quit taking it, so I'm not on it right now. And people say, will I gain weight after I quit taking this medication? And I always tell them it's up to you.
Yes. I will say I was off of my medication because they weren't able to get it for a particular amount of time. So I took 2 or 3 weeks off. And I will say that in that time, I gained about 7 pounds. But it was because I allowed myself to eat more and go back to my binging habits right away. And I know now, I'm glad I had that small time of experience as learning experience. So when I come off of it again, I know that I have to stay under control with that.
Absolutely.
Because the hunger does come back.
Yeah, hunger will come back, but you need to adopt healthy habits.
Yes.
Going to gym, exercise, weightlifting is a huge one. I recommend everybody to, men and female, do resistance training, weight training. You want to gain more muscles because you look better. You know, you lost weight, now you want to look more cut. So there's a motivation. And also change your habits of eating habits. Don't eat fried food. Mediterranean diet, heavy on lean proteins and vegetables. So if you go back to your fried food and Chick-fil-A and your fried food, I mean,
your weight's going to spike.
Yeah, I mean, medications are there to help you. It's not going to change you just by itself. That's where the personal responsibility come into picture. If you don't respect your body, there's no medication in this world that's going to help you forever. This will give you the nice push, motivation. Oh, I lost 30, 40 pounds. Now I need to work out to look even better. It helps you a lot in that respect. But don't expect this medication to be one-all, cure-all kind of medication. I mean, you have to change your life. You need to change responsibility for your bad habits and change your life around. Don't go back to, otherwise you will be up to a very bad disappointment with this medication.
Yes, and just like you said, you really do have to follow it. You obviously don't have to, but if you do follow it with a clean diet and you're supplementing properly, and you're getting all those foods and nutrients that your body needs and exercising regularly on top of it, not only do you lose more weight, you lose more inches, but you feel so much better.
Absolutely.
If you just think about it, all that weight that 20 pounds of weight is so much to lose. And all that like weighing on your heart and your organs going away, you automatically you start to feel so much better. My mood increased. I was less depressed. I was more focused. So there's so many more benefits to this than just the weight loss itself.
And I have a cardiologist friend. He prescribes Mounjaro just for congestive heart failure or other heart problems. Actually, it helps with your heart health also. And now they're studying if it helps you with dementia and other things. But think about it. If you only lose weight, your blood pressure will going to decrease. So your hypertension might go away. So you use less medication or no medication. The patient lost 100 pounds. I took him off his blood pressure medication because he didn't need it anymore. So that was huge. Your fatty liver disease will reverse. You will have much leaner. Diabetes, obviously, it's the main thing it controls. And other orthopedic problems like knee pain. You know, when you weigh like 60, 80 pounds less, I mean, your knees will hurt less.
Yes.
Your calves in the end of the day will hurt less.
Yeah, so if you got joint problems, you know, pain, chronic pain, all of these things are going to get reduced when you're getting more healthy, which is including losing weight.
And your back pain will reduce. And also because you lost weight, you can do more cardio, you can run more, and you can do more things. So overall, it's amazing medications if it's used responsibly. By the way, there are some patients I have, they're skinny already and try to get on this medication. Please do not come to my clinic. If your BMI is below 25, I will not write you Mounjaro. You're good enough. I need to practice medicine safely. You are not going to get it. I'm not going to let you get anorexic at my medical license. So don't even try to come to my clinic if you're already skinny.
Yeah, we'll help find you a personal trainer to help you a little bit with
at that point, you need exercise. You don't need any medication. So don't overdo it. Like anything else in life, do it in moderation. If you overdo anything, even a good thing can become a bad thing. So I don't recommend you use this medication to go to crazy BMIs. Because if you lose a lot of fat, it will affect your bone health, it will affect your menstruation, it will affect your cognitive functionality. So don't overdo it, my friends. There's also a limit how much you should use. I hope this podcast help people to answer the questions they have in their mind about these drugs. Being the cost is coming down to $500 a month, it becomes a financially feasible alternative to get invasive surgeries, bariatric surgeries, liposuction, all kinds of crazy, expensive and dangerous procedures that you should avoid at any cost. This medication is a very good alternative that's not invasive. And it's also economically very feasible. I mean, $500 a month, yes, it's a lot of money, but I mean, to lose 20 pounds is not that bad at all. At all.
So I think that if you're looking for a really positive weight loss experience, the best doctor that you can talk to who's going to care about you the most. This is from my personal experience. I was a patient of Dr. Hatemi's before I started producing this podcast, and I want to say that he will give you the attention that you're looking for that you can't find elsewhere.
Yep, let's change your lifestyle and then let's get it on it so you will be a better person. So by the New Year's, you are a brand new person. So you don't have to make a New Year resolution to lose weight. You're already in the best shape of your life. New Year's coming up in about 5 months.
Yeah.
So let's work on it now so you look good on that New Year's party. And is there anything else do you think we should talk about? Anything you think we forgot to cover?
I think we're golden on this topic. And if you're looking for more information, just check out Veritas Urgent Care on YouTube, Facebook, Instagram. And you can find this podcast on iTunes and Spotify as well. If you're looking for more information, go into the clinic. Walk in. When will you be there normally?
I'm usually Monday, Tuesday, and Wednesday, and Fridays. I will be in the clinic in Lexington. If you have any questions, you can ask them in the comment section, or you can come and ask me privately in the clinic during your visit. Also, please share this video. We would like other people to know about this information and resource, and we would love to help you in any way. So if you share this video, it will also help us spread the news and spread the word about these medications.
Yeah, one thing that I like to do to make sure I'm going to see Dr. Hatemi is I just call the clinic beforehand, ask if he's there, and then you don't make an appointment. You literally just walk in, and then you sign up, and once you sign in, you'll get to talk to Dr.
Yeah, as long as
Hatemi.
I'm in the clinic, you don't need an appointment. You just walk in, and I will take care of you.
Thanks so much, guys.
Thank you, guys.